The Birth Justice Collaborative is an African American and American Indian-led coalition advancing maternal health and birth justice in our communities. We raise up and incubate community-driven strategies and movement build to resource and realize our work.
The way in which the collaborative views birthing and caregiving and the parent and the mother and the child first and survival is I don't really have the right words because it's more of a feeling. It's a feeling of love and joy and finally and relief.
BJC began its work in 2022 to identify and implement community-based and led solutions that address alarming maternal health disparities, including preventable maternal death rates for American Indians who die at 8 times the rate of white Minnesotans, and U.S.-born Black African Americans who die at 3 times the rate of white Minnesotans.
We have a long history of really rich birth stories and birthing traditions, and they were all taken from us. So I think just the idea of these communities coming together to put birthing back into the hands of these women is really, really beautiful and important.
BJC accomplishes its work by doing what is rarely done, listening to, trusting, and implementing community member wisdom. The work started by convening over 300 community members to identify what they know will improve maternal health. After that, 30 of the community members, along with 20 health system, payer, and government representatives, formed a leadership coalition that shaped the community guidance into 5 main strategies that reflect the future we want to live into. Then we checked back with community members to make sure the strategies captured their guidance.
It's been through the Birth Justice Collaborative that we've been able to come together as a community, come together as a people, and support each other on how we can strengthen our spiritual ties to the land.
BJC's 5 guiding strategies are acknowledging and addressing the impacts of racism, creating cultural workforce pathways, expanding anti-bias and accountability in systems, investing in a network of trusted cultural providers, and advocating and radically reforming policy.
BJC's work includes providing an evidence-based home visiting cultural parenting program with financial support for the first year after birth.
I wouldn't even have this job if I didn't believe in the pilot program, because I think it's such a good opportunity for Indigenous and Black families to have a doula and then to also have somebody that they can go to that's like a good auntie.
In comparison to families that did not receive postpartum home visiting and cash support, pilot participants experienced greater mental well-being, less stress and financial strain, and greater confidence in parenting.
Having somebody that looks like you, be able to attend appointments with you, to have conversations with you, it makes a difference for the baby, it makes a difference for the mom, it makes them feel more comfortable.
Systems change through sovereignty is key to BJC, as seen in Home Place for African American families.
When our birthing parents come, they know not only are they greeted with good cultural food, they know that their well-being is going to be tended through connection, through healing-centered engagement, through love and love in action.
And so when you have a village, when you have a home place, there'll be another young lady who could have said, hey, get over here. And they'll help you figure out how to tell your mom. Or, we'll at least make sure that you're taking care of it. And then after the baby's born, in a situation like that, somebody needs to come around her family and her to navigate those next steps.
Similar to Home Place, BJC is planning an urban American Indian birthing center.
I want my grandchildren to be born at this birth center. I want my children to be educated and have home visitors. I want my children to have an Indigenous midwife to support them, an Indigenous doula to support them.
For me as an Indigenous mother, that looks like me deciding, what is my birth plan? Me deciding, what teachings, what wisdom that my mom or her mom's mom passed on to her that I want to take and hold within me to then instill in my child.
The success of cultural supports like Home Place and the American Indian Birthing Center depends on advocating for and supporting community-based cultural birth workers to provide whole family care.
Birth work, or making sure that our families are brought into the world happy and healthy, like that's a family's responsibility. We gotta involve men in the space. We have to. They're the other part of the equation. You know, another quote or phrase I always use is, if it takes a village to raise a child, why aren't we only equipping half the village to do so?
And the community is responsible for that. We shouldn't, wait until there's crime. We shouldn't wait until there's homelessness. We shouldn't wait until there are problems when we can start it from the beginning.
Affecting needed changes requires us to change ourselves for what is needed through education and self-advocacy, including pursuing a birthing bill of rights for all parents.
Through the Birth Justice Collaborative, we continue the conversation so that we can build some sort of a sense of self-advocacy. Because I think we can't wait for large systems to kind of improve despite best efforts. We have to know what we're up against. We have to know how to take care of ourselves and our families.
And finally, partnering with systems to provide unbiased, supportive care is another aspect of BJC's work.
The systems have evolved to a place where they are really doing some parts of caring for people's health well, but they have totally missed the vitality, the richness, the abundance of ancestral healing, of cultural connections, of the wisdom of the ancestors.
So as the first Black County Commissioner, it is an obligation and a duty that I do not take lightly to uplift the lives of Black, Brown, and Indigenous communities, especially our women who are dying too fast and from preventable deaths because we have a healthcare institution that does not prioritize our care nor believe us.
We had a conversation of empowerment and how could the community empower themselves, and we are our own solution. And so Home Place to me means we are creating a place for African American families to come together and we can be ourselves, and everywhere we look, it is about us.
We are not waiting for somebody to save us, and to take care of us. Like, we as a people know what's best for us, and we have those inherent solutions within us, and we live them out every day.
Investing in culturally grounded, community-based perinatal support is not just wise, it is strategic. Every dollar invested in this type of support creates a fourfold public value by improving maternal well-being and avoiding costly outcomes. We can't afford not to do this work. Please join us in advancing birth justice.